Hi and Assalamualaikum. Today we will present about black lung disease among coal miners in mining and quarrying sector. Before we begin, let me introduce myself. My name is Nurina Fakihah binti Ismail.
Hi, my name is Aida Nadira Azmi.
Hi, my name is Nuzul Farahin binti Zulkifli.
Hi everyone, my name is Nur Amira binti Mohammed.
Hi, my name is Riana binti Haridin.
Hi, my name is Nur Ifah Muhammad Lutfi. First, mining refers to the process of extracting valuable minerals and geological materials from deep underground. This often includes materials such as metals, ores, coal, and rare earth elements, which are usually found at significant depth of Earth's surface. On the other hand, quarrying focuses on extracting materials that are closer to the surface. These materials include stone, gravel, sand, and aggregates, which are mainly used in construction projects such as roads, buildings, and infrastructure.
Black lung disease, also known as co-workers pneumoconiosis (CWP), is an occupational type of pneumoconiosis caused by long-term inhalations and dispositions of coal dust in the lungs and the consequent lungs tissues reactions to its presence. One of the symptoms is presence cough, shortness of breath, chest tightness. Symptoms can take years or decades to appear.
This section explains the trend analysis results of coal production and black lung disease among coal miners in Indonesia from 2013 to 2021. Based on the results, coal production in Indonesia generally increased from 2013 to 2021. Although there were some fluctuations, such as small decrease around 2016, the overall trend shows as increase. By 2021, coal production had increased by about 24% compared to 2013. During the same period, new cases of black lung disease were detected among coal miners. A total 112 new cases were reported, with an incidence proportion of around 13.9%. The number of cases increased over the years, showing an upward trend. When both trends are compared, the increase in black lung disease cases appears to follow the increase in coal productions. This shows that as coal mining activities increase, miners may be exposed to more coal dust, which increases the risk of black lung disease. When we talk about high-risk group for black lung disease, coal miners are the most affected. First, miners between the age of 35 and 44 are regarded as high risk. Workers frequently have years of coal dust exposure at this point, which raises the risk of lung disease. Tenure or length of employment comes in second. Longer tenure in the coal mining sector puts miners at greater risk because of recurrent and prolonged exposure to coal dust. Individual characteristics are another crucial components. Alcohol and tobacco use put miners at high danger, especially smoking increases lung inflammations and impairs the lung ability to expel dust particles, accelerating the cause of illness. Finally, health is a significant factor. Severe forms of black lung disease are more likely to occur in miners who already have respiratory disorder such as asthma or chronic obstructive pulmonary disease or COPD.
One major factor is duration and intensity of exposure. Black lung disease is far more likely to strike miners who work in mines in an extended period of time, especially 10 years or longer, and those who are exposed to high level of coal dust. Next, in the work environment, surface mining is less risky than underground mining. Large volumes of dust are released during cutting, drilling, and moving coal, which make it simpler for miners to breathe in dangerous particles. Protective measures are another crucial component. Lung damage is more likely in mining locations due to inadequate ventilation and respiratory protection, which increase the amount of dust inhaled. Now, let's talk about behavior and individual factors. Smoking is a significant risk factor. The disease advances more quickly because tobacco smoke exacerbates lung inflammation and increased carrying caused by coal dust. Another factor is age. Due to history of exposure and a gradual decline in lung capacity, older people may be more vulnerable. Finally, health status matter. Severe symptoms are more likely to occur in people with pre-existing lung problem or poor general health.
Black lung disease caused by a long-term inhalation of coal dust in mining activities. To prevent this occupational lung disease, effective control measures must be applied in the workplace. These strategies follow a hierarchy of controls starting from the most effective method to the less effective method. The most effective way to prevent black lung disease is by controlling coal dust at its source. This can be done by using low dust equipment, wet drilling method, and replacing older machinery with several alternatives. The second best approach is engineering control. This includes proper ventilation system, enclosed operator cabin, and water spray system. These controls help prevent coal dust from becoming airborne and reduce the amount of dust inhaled by miners.
Personal protective equipment, PPE. The use of respirators and other protective equipment is considered the least satisfactory control method, as it relies heavily on worker compliance. However, PPE remain important when dust level cannot be fully controlled by engineering measures. Miners should be provided with approved respiratory protective devices, properly fitted and regularly maintained. Training on correct usage is necessary to ensure effectiveness. Next, enforcement, monitoring and regulatory control. All preventive approaches must be supported by strict enforcement of occupational safety laws. These include regular monitoring of coal dust concentration, medical surveillance of miners' lung health, and periodic review of exposure limit. Regulatory agencies should conduct routine inspection and ensure mining companies comply with established occupational exposure standard to prevent long-term respiratory disease. So that's all from us. Thank you for watching, guys. Bye!